Hi, this is Steve Szara from Szara Dental Lab, and welcome back to my orthodontic lab video channel. In this video, I'm going to show you a technique that I've been using for years on how to reduce chair time in delivering a retainer, especially in the anterior portion. It's a little trick that I learned. I think you're going to appreciate it if you don't know it. So let's get busy. And remember to hit the notification bell to be notified of all new videos. Recently this week I had a discussion with a doctor about removing acrylic that the patient was biting into. This technique is very helpful when you receive an upper and a lower model. So typically if you're making a retainer and you only have an upper model, let's say the doctor or the staff only gives you an upper impression for a retainer, you're going to go ahead and bend your labial bow, and where you're going to put the acrylic is you're going to be a little bit of a guesswork. And you don't want to put it too low. Some people, you can scallop the retainers, but I barely ever see that anymore. But you want to put it somewhere, that's going to be not too high and not too low, in a nutshell. So the problem is, the patient comes in and you make the acrylic, and their actual bite is a little tighter. So what's going to happen is they're going to be hitting on their acrylic, which is a real pain because then the doctor has to run back to the lab and try to reduce the acrylic, refinish it, repolish it, etc., etc. This is a complete time wasting because with this trick, all you need is a mechanical pencil. It doesn't have to be any size, just a mechanical pencil. You're going to pull the lead out. So with this trick, if you have a lower model, you're going to put the models in occlusion. You can see that they have a deep overbite. So you're going to go back, pull out your lead pencil, and draw a line, a dark line. And this way, when I go ahead and finish my retainers, now I can see that I want to be, my acrylic needs to be below this line. Anything above it, well, you'll be hitting into it. So this is an awesome technique that's going to show you where to build up your acrylic and where to cut it back. So then this way, when the patient goes in to bite into the retainer, they're not hitting plastic, acrylic. So I'm going to go ahead and make these retainers and we'll go from there. And here's a little bonus tip that I like to do. I just added the acrylic to the retainer, and I'm going to take my lower impression, or lower model I should say, and bite it into the retainer. This way you'll see exactly where it's hitting. And I'll freeze that spot so it doesn't slump. And there you can also help reduce the acrylic so the patient isn't biting into the acrylic. And I've been finishing the retainer, but there's these white spots. Those aren't teeth that were broken off. It's just the white polymer that I sprayed in the very end to freeze it. I'll take an e-cutter and I'm going to use my high-speed handpiece and remove the white spots. When I get down to the base layer of the acrylic, which all the white spots are gone, then I know that my lower teeth are not going to be biting into my upper retainer. This is a little bit of a trial and error. You have to keep putting it back on the model and seeing. You're going to try it again twice. The first time you remove the white acrylic, the polymer, from your teeth biting mark, which was the bonus tip. In the second, you're going to fit the retainer onto the model and reduce the acrylic below the black line. This tip is going to save your doctor so much time when he goes to deliver the appliance if you're not doing this already. And here you can test the occlusion to make sure that you're not actually hitting the acrylic with your lower model when you occlude the teeth. And if you are hitting or touching somewhere, then you're going to relieve that spot. Like I said, it's a little bit of a trial and error, and it takes some finesse work, but all in all, it's going to make for a very comfortable retainer, and your patient and doctor will be happy. Hey, I hope this video helped you. Remember to hit the subscribe button if you want to see more orthodontic videos, and leave a like. See you in the next one.